Welcome, everybody. We have an exciting guest this evening, and I'm basically going to turn it over to her. The one thing that I must tell all of you about our guest this evening that sort of pisses me off is that she gets way more people signing on to these lectures because of her enormous volume of information that you are about to learn and hear than I ever had. So, with that in mind, it's okay. It doesn't piss me off that much. But with that in mind, I give you Kathleen O'Neill, for a physical therapist from Evolution Physical Therapy and Fitness. And I'm going to go have dinner and sulk. So here you go. And Kathleen, thank you so
All
much
right,
for
thanks,
coming
David.
tonight. Great.
Yeah, happy to be here. Hi everyone, I'm Kathleen. I may or may not have met you at some point at an LA Roadrunners run. I'm a physical therapist at Evolution. We have a number of clinics in LA. I think we're up to 12. I've lost count. Um, and I've been lucky enough to work with LA Roadrunners probably for the last 4+ years. Today, I'm going to take you through what we call the skills checklist for the runner. So it's a battery of tests, performance tests that we think really encapsulate the mobility and stability and strength needs that are required of running. They're kind of a good initial way to see if you have any imbalances or any areas of weakness that might predispose you to an injury as your training volume goes up. Now, I'll also provide some suggestions that will kind of take you through the test. If you're in a space to try it out, feel free to follow along with me. And then I'll talk through if you really couldn't do that, try X to address it. At the end, I can answer questions that you might have as well. I'm going to drop a blog post that has the skills checklist in the group chat. Feel free to open that up if you want to follow along. There's a couple different, there's a chart for the calf raises and for one other thing. So if you're taking yourself through this test as we go, you can check and see what your score was. That way, if you're not able to do it now, then you can reference it later. All right. So I'm going to be moving my computer around a little bit. Our first test on there is called toe yoga. So we should be able to move our big toe and our four toes separately. What this does is it just shows us, do you have any control or coordination, mainly over that big toe? The big toe is pretty important when we're running. It helps with our push off. It's a point of stability when we're on one foot. So this is kind of just an initial assessment. Do we have enough kind of dexterity in our feet? The other thing that I think this is important, or why this is important, is because these small muscles in our foot that help control the toe motion. They are really helpful in absorbing shock when we land. So when we're walking or running and our foot hits the ground, we have a bunch of really small muscles in the bottom of our foot. Those need to be able to help us absorb shock so that some of these other structures, our plantar fascia, tendons, bone, don't take too much stress. And then feel free to, if you at any point in time have questions, you want to interrupt me, just unmute and ask me as we go. Our next test is called a knee to wall. So I'm going to show you, I'm going to do this and use this as my wall. this looks at our ankle mobility. So specifically your ankle dorsiflexion. So you're going to line up your big toe against the bottom of a wall, or if you have a roller, you can do a roller, a long one. And then you're going to lunge your knee over your third toe to see if you can tap your knee to the wall. And what you can do is, so we start with our toe against the wall as if you go to tap your knee to the wall, and that feels pretty easy. We're going to use this as a side to side measurement and really see if there's a big difference side to side. So once you kind of, okay, I start with my toe at the wall, I'm going to tap my knee to the wall. Then I'm going to slide my foot back just a little bit away from the wall and then see if I can, keeping my heel down, if I can then reach my knee to tap the wall at that far away. That feels like that's easy. You can slide your foot back and then see if you can tap your knee to the wall from there. Now, for me, I'm already kind of feeling my heel pop up there, so that's probably my maximum. The we really just need for running. Ideally, we need your knee to be able to basically just meet the end of your big toe. You don't actually need that much dorsiflexion. For walking, ideally we have a little bit more than that. So ideally you could lunge and get your knee kind of a little bit past your toes, where your toes end. And then compare that to the other side. So there's no specific number you need to hit for this, despite like if you read online, they might give you a benchmark. I really like to just use this. Okay, is this really limited? Like, can I not get my knee over my toe? Or is it really different side to side? So assess and compare to that side, slide your foot back, try to tap your knee to the wall there, slide your foot back. And I can already, I knew this, but I can already tell that my left side has a lot more mobility than my right side, which makes sense. Because if I ever have a running related injury, it's always on my right side. Dorsiflexion is important because when your foot hits the ground, we need to have a little mobility in that ankle joint to help cushion and absorb shock. It lets our like tibia or our lower leg come over our ankle. And just like with the muscles in the feet with the toe yoga, big thing we're looking at for this in terms of like why this is important is it really just helps with shock absorption. So running and walking, we're thinking we're doing a ton of steps. It's very repetitive. We want to set ourselves up for success to have good shock absorbers so that some of those other tissues that I mentioned when we were talking about the toe yoga, so your plantar fascia, your posterior tibial tendon, your big toe, all of those kind of tiny bones in your foot and ankle, that they don't end up taking up too much load because we don't have enough mobility up the chain. All right, so our next one, we're going to do a lateral step down test. So at home, if you have a stairs in your home, you could test this on a stair. If you have a curb outside your house, you could do a curb. If you have a step like this, you should set this step at a minimum with one riser underneath it. I'm going to do 2 here because that's more aligned with the standard step. But the big thing is just making sure it's the same on both sides. You're using the same step height. And if you're using this to kind of track how you're improving over time, that you're using the same step, because if you test this on a higher step and then you retest yourself on a short step, it's going to be a lot different. All right, let me slide that back. So your hands are going to be on your hips. We're sitting your hips back and tapping your heel down towards the ground or on the ground and coming back up. So we're not shifting weight. It's just a tap, come back up. Tap, come back up. Now, if you're looking at that blog post, there is a table you can self-score yourself. So some compensations or things that would be a points deduction on that table would be if you're leaning at your trunk a lot, if you have to stabilize using your arms a lot, if you have to drop your hip a lot, or if your knee is coming really far over your big toe. So a good test looks like level, kind of upright trunk, so you're not leaning side to side this way, level pelvis or hips, and then knee kind of in line with the middle of your foot. So you test there. Your goal is to do 5 reps and then grade yourself with that criteria. And then same thing, compare side to side. So as you're taking yourself through these tests, you might start to notice some trends. Like, okay, my ankle dorsiflexion with the knee to wall was a lot tighter on the right side. And you know what's kind of interesting? My lateral step down on the right side was a little more wobbly, or I felt like I saw more of those compensations that are listed in that table. You might start to notice those patterns, and that's a sign that this is something we should work on. I kind of failed to mention in the toe yoga section, like, okay, if you're really bad at that or you can't do it, how do you treat it? The nice thing about the first one is though you improve it by just working on toe yoga. So it's just a brain muscle connection thing. So the more you practice that, it will click and it will get easier. So, when you're at home standing in front of the TV or you're cooking dinner and you don't have shoes on, you can practice your toe yoga. If you do that a little bit every day, it's going to get better. For the if the knee to wall is very limited, you can just do that stretch or that kind of make that just a more of a dynamic thing and find the wall and just kind of you're lunging to tap, kind of rocking back and forth. So the nice thing about a lot of these tests is like you can treat it or improve it by reproducing the test. The other thing that you can do if you're noticing you're really limited with the knee to wall on one side is just your standard half stretching up the wall. So both with your back knee straight and with that back knee bent. That's going to get a little bit deeper into the calf complex. So for the step down, if you're noticing your step down is really wobbly or it's really challenging, you might have to start, if you go to do that and you feel like you can't do even a couple reps, you might have to dial that back and work a little bit on your glute strength and make that a little bit easier. So I would like, and in the clinic, I would pair, if you're really wobbly with the step down, I would pair to start a clamshell. Everyone here probably knows clamshells. Now, I I think clamshells are good as an initial kind of okay, what do I start with? But they're just the beginning. So and they're not like the fix all. So I rebuke the I went to a PT and they said I just need to do more clamshells. There's usually like a lot more than just glute strength, but a clamshell, knees stacked, you're going to open up, come back down. You want to kind of be all the way laid down. Big thing with this is making sure we're not rotating at your trunk. So we're just lifting that top leg up and back. Now, I would pair that at the same time with 2 other things. We then take your band and we do a little standing glute strength because with running, with walking, we're upright. So a clamshell is only going to do so much. This is going to translate a lot better to making your single leg stability better. So all of your weight's going to stay on this one leg. We're going to do a lateral toe tap. So you're tapping out to the side and back in. Key being, you'll recognize some of these same things. So pelvis stays level, trunk doesn't lean side to side, knee doesn't pull in. Those are all of the same things that are on that scoring sheet for the step down test. From the side, we want to be in this little hinge. We're kind of tapping out and just a touch behind. It is mostly to the side. Okay. And then the last part of the puzzle here is just practicing more lateral step downs, but you might have to make the step a little bit lower. So if you are doing this at home and your step's really high, maybe you can go outside if you can find a curve that's going to be lower. So I drop a level here. You can even keep the band on and practice a lower lateral step down if what you tested on was challenging. The other thing you can do to help, excuse me, is hold on to like a stick. Give yourself a point of balance in this opposite hand. All right. So the next thing on that checklist is a side plank with hip abduction. So your elbow is going to be down and your bottom knee is bent. Before you go to lift up, make sure your elbow, your hip, and your knee are all in line. This knee shouldn't be really far out in front of your hip. Then you're going to press up to lift up off the mat, and then lift this top leg up and hold. Now these are really tricky. So to pass this test, you should be able to hold for 30 seconds on each side. You might be setting this up now and just getting into the side plank feels challenging. So this one's a nice and easy one to remember too. The best way to get better at your side planks is to do more side planks. But I'm going to show you a couple regressions if this full side plank with hip abduction is too challenging. So you can do just a regular side plank, stack up on both knees, and just meet yourself where you're at. So that might look like a 10-second hold to start, and then just slowly start building up and trying to get towards a 30-second hold in that position. Then you can move on to a side plank, bottom knee is bent, top leg just stays on the ground. So this is a little harder than the both knees down, but it's not quite as hard as this. Same thing, build up your hold time there until you feel like you can do this. Some things to look at or to be mindful of when you're testing this or when you're doing side planks at home. I'll show you from this way. We want to make sure we're not, so we want to make sure that when you're up in your side plank, that you're not tipped forward down towards the ground, or you're not open up too much this way. So you really want to imagine if someone was putting a spear through both shoulders, it would be perpendicular to the ground. And then the other thing you want to make sure is that you're not arched through your back and this leg isn't cheated forward. So nice long line from head down to toe. All right. We got two more.
Kathleen, this is David.
Yeah.
The video does not show a bent lower leg. It's both of them are both legs are extended. What's the difference?
I would do the version I showed you. That full version is really hard. And I think that with the bottom knee bent, I think it's still adequately challenging and still assesses what we wanted to assess. So if you go to set it up with the knee bend and that feels really easy for you, you can crush 30 seconds, then by all means do the full side plank. But I think that version that's in the blog is really challenging. But great question. Thank you for pointing that out. Why is that important? So the side plank, especially with the leg raise there, the hip abduction, that looks at your obliques, so your lateral core and your glute med. We need both obliques and glute med to help keep us nice and strong on one foot. So in this position here, I'm standing on my left leg. My left glute med is working hard to keep my pelvis level versus letting that hip drop that way. When we're running, especially, it is just a series of single leg squats over and over again. So we really need that glute med to be strong to help keep that pelvis relatively stable or level. You know, a normal amount of hip drop will happen when we're running, but having good strength and stability through these muscles is just going to decrease our injury risk when we think about things like IT band issues, some like hip tendinopathy issues. And then that can go all the way down the chain, like down to foot and ankle too, if we've got a lot of drop at our pelvis. And then the obliques helps as well, just kind of keeping our trunk upright so we're not kind of shifting side to side when both running and walking. All right, so we have two more. The next one is, I think it's the most important and probably the least, I don't know. I feel like most times when I talk to runners, they're not doing any calf strength. So the heel raise test looks at our calf complex strength. Our calf is there's two muscles in our calf, our gastroc and our soleus. That is the most important muscle of running. I mean, I might not think that. I think people think it's their glutes because, you know, if you go to a lot of PTs and they find out you're a runner, they're just going to say it's more glutes. But our calf is super important. Our gastroc needs to absorb 2.5 to 3 times our body weight when we're running. It takes up even more when we're walking. And then our soleus needs to absorb 6.5 to 8 times our body weight. So if we can't do 5 single calf raises, think about how much load we're putting through our calf and through, you know, things up above and below the calf when we're running or walking for 26.2 miles. So this, I think, is like, if I had to pick one that's the most important, this is the one. So we're going to set this up off a step. Hands should be on a wall. So this isn't a balance challenge. I don't want you to be worried about your stability. You're going to go straight up and straight down, nice and slow and controlled when we're thinking about this test. And you're going to see what's the maximum number of single calf raises you can do and compare side to side. You'll see in the blog, there is a chart. So there's recommended values for men and women in different age groups. Specifically, when we're thinking about runners, runners and walkers too, especially walkers that are doing a full marathon. You know, calf strength is important for, you know, anyone. Your non-marathoner. You know, it's important for our balance reactions. You know, our calf strength reduces really dramatically, especially in men after age, I think it's like 27. So that's why you see an increased incidence of like Achilles tears in men, like 30 to 40. So the calf is important for everyone. I will say that table, that chart, those values are a little bit higher than your kind of average non-marathoner, just because that muscle is so important for running. So see where you're at, you know, now. If you're substantially below where you should be for your age and gender, I would definitely start working on your calf raises. If you, for example, were only able to do you should be able to do 20 and you were only able to do 5 in a row, single leg, then I would actually recommend starting double leg. Do 3 sets of 15 to 20. Get really strong at the double leg and then progress to the single leg. And the nice thing is we get better at this by just doing more calf raises. You might have to start on the lower end of the rep range for the single leg calf raise when you make that transition, or if you just did 8 and you were cooked, like you might have to start doing sets of 6, and then just slowly build your way up until you can hit that. Okay, I'm I'm a woman in my 20s. I can do 30 single leg calf raises in a row. And then eventually we do want to progress calf strengthening to be weighted calf strengthening. So if you hit those benchmarks, but you're not doing any calf strength with weight, that's kind of your next, like the next way to level up. That way you're meeting that 2.5 to 3 times or 6.5 to 8 times your body weight. If we're getting closer to that demand on the calf if we're adding weight to the calf raise. So that would look like, be pretty simple. I like to use a box or a step. I put one foot on this step and just I like the heel flow because this is really just here for balance. I've got a weight in each hand and then going straight up and straight down on the calf raise. So make sure you can nail them body weight first, but then eventually work up to a weighted calf raise. All right, we got one more. So last one is a single leg bridge test. This looks at your glute max, your hip extensor strength, and your hip stability. Same thing, this goes back to like, can we keep our pelvis level? Just like we talked about with the step down. Just like it's complementary to the side plank. But then we need a lot of hip extension strength with running and walking. So kind of tackles both of those things. So you're going to lay flat on the ground, both arms either at your chest or above your chest or across your chest. You're going to bridge up into a double leg bridge and then kick the other leg out and try to hold there. A passing score is 30 seconds holding on each side. So some things to look at here. If you go to set this up and you feel like immediately your hips dropping, then I would start by working on, you should make sure double leg bridges feel easy. If double leg bridges feel easy, but you're really wobbly on the single leg bridge, you can just work on it in like the same testing position, and you can, use your hands on the ground to help it first to start. I really like this variation where we've got one knee hugged to your chest gently, and you're driving through a single leg bridge on the other leg. So I'm not pulling up on this leg. My hands and my opposite leg are really just relaxed. All of the work is being done on the foot or the side that the foot is on the ground. The knee to your chest just prevents us from compensating through lower back. So if you're doing a bridge and you're feeling a ton of back pain, it probably means you're not actually loading your glute max or your hip extensors. You're just arching at your lower back. So if that's something that you're feeling, then drop yourself back to a double leg bridge. And I want you to think about before you go to lift, squeeze your butt cheeks together. And then don't worry about height. Because I see people, they drive up and that last bit is just all back extension. So really think about squeezing your butt cheeks, press through your heels, and lift just until you feel like you kind of run out of room. You don't need to go for max height on that. So I think that's kind of a good initial taste of what to look at, how to self-test. Of course, when we're really thinking about injury prevention, from a physical therapy standpoint, from a strengthening standpoint, um, you should be complementing your training with some amount of resistance training. If you are really new to strength training, then that might look like body weight exercises like we just went through. And you're doing them body weight for a while. If you're someone who has experience with lifting or you're lifting a little bit, but as soon as you started training for the marathon, you stopped, you want to make sure you're still doing at least a little bit of lifting with weights throughout, really up until we get, a month inside race day. Questions?
Good. I am actually still here. I don't see, I stayed through the whole thing. Um, I always learn or remember something I've forgotten every time I listen to you, but I right now don't have anything in the chat right here. If anyone has any questions, you could either click on chat and type it into the chat. And I do see a question from Connie. What is runner's knee? What is runner's knee?
It depends. So, um, runner's knee, it depends on if it's irritation at the kneecap. That is fairly common with runners where we kind of have irritation or rubbing and like pain underneath the kneecap. You can also have knee pain that comes from the patellar tendon. So that's like the front of the knee, but would be pain kind of just below the kneecap. And then you can also, fairly common is IT band pain. So that looks more like outside of the knee pain. So yeah, it really just depends on what's the source of the knee pain, but I would say those are probably the most common sources of knee pain that I see in runners.
Hmm. Good. Anyone else, you can always scroll your cursor across the screen and click on the audio button, and we can hear you.
Kathleen, this is David. How
Mhm.
many times per week should you do go through this PT routine?
Yeah, so I think take yourself through the first, the testing and see where you're at. If everything needs a little bit of work, then uh, doing this like 1 to 2 times a week, especially if you're in the middle of training for a marathon, 1 to 2 times a week to start. That's a good place to start. If you go through that test and you're like, okay, I was actually really good at these two things, but all of these other things were not as good, then you can kind of prioritize, like maybe I'm going to do my lateral step down was really bad, so I'm going to do that 2 times a week or maybe 3 times a week to start. But my bridge was really good, so I'm still going to do that for maintenance, but maybe I'm going to do that when my mileage goes up. I'm going to do that 1 time a week. Now, my answer to that is a little different once we're post LA Marathon. The best way to stay injury free is to periodize your training. So we can't be in marathon shape 365 days out of the year. So post marathon, and we can't be lifting our max amount of weight or strength training 4 days a week when we're running more miles than we have all year. So post race, the answer to that is really different. Like maybe we we cut back on the running a little bit and we prioritize more strength training. And that's when, okay, if we're not doing weightlifting, that's a good time to kind of do a little bit of weightlifting. Yeah.
All good. Joe, hello. Joe says, how, whoops, just went away. Here we go. Yeah, he says, how about red light therapy for knee? Is red light therapy for knee pain work?
There's with those things, there's not a ton of great like science-backed evidence. Some people swear by modalities like that, but I don't feel like I've seen enough consistent like data or clinical, results that would make me say, yes, you should do this for your knee pain. If you're having consistent knee pain with running and you haven't seen a physical therapist, obviously I'm biased, but that's going to be a better use of your time and money than getting red light therapy. Like that's kind of more of a passive modality. Something like seeing a PT is going to be a lot more active and more likely to make long-term improvements.
Good. Alicia asks, hi, when should I foam roll and what are some good ways to foam roll? We're actually going to be doing a whole one of these nights about foam rolling. But the other question that I have to add to that is what is the difference between foam rolling and stretching?
Hmm. Yeah, so foam rolling I think is a good tool, especially as your mileage gets up and you're, sore. Um, I, I think like if we look at actually the guidance that they, that uh, federal guidance on movement and exercise, like mobility 2 times a week is actually the recommendation, and I think that's pretty good. Like even for marathon training, like you know you I don't foam roll every single day. A couple days a week, or if something feels tight, okay, my glute feels tight, I'm gonna foam roll a little bit. It's not something that I think you need to spend hours a day on. And then in terms of stretching versus foam rolling, um, you know, foam rolling is the kind of thought or science behind it is that putting pressure on with the roller, it gets blood flow to muscles and tissues, and then makes us a little makes movement a little bit easier afterwards. And even just the pressure of the roller, um, it's basically like a distracting input for our nervous system. So it can help decrease like pain, like muscle pain. It's not going to fix like injury pain, but post exercise soreness, it can have a positive effect on stretching. I mean, we have a similar, I guess, intent, like improving mobility or improving tolerance for movement, just a different mechanism. There, we're looking at, if we're thinking we're doing longer hold times, we're looking at kind of improving that like um, extensibility of the muscle if post run or walk we've gotten very tight. And same thing for that. Like I think the big thing to delineate with stretching is just making sure that you're before you run, you're not doing a ton of static, like long hold stretching. That is better suited for post run. After your run, that's a good time to do those longer holds, 30 seconds, 60 seconds. But before you run, you want to do more of a dynamic warm up, because running and walking is we're putting our muscles through a stretch shortening cycle. And so we want to prepare our muscles with a more dynamic routine before that so that we don't stretch that muscle out and then ask it to go through a quick stretch shortening cycle.
Good. Let's see. Vanessa asks, so these could be good exercises incorporate during rest days. I guess the question is when do you do all of this stuff?
Yeah, I think like the most real answer is like whenever you can fit it in if we're thinking activation and mobility. You know, people's lives are busy and schedules are busy. So, none of what I just showed you is really gonna it shouldn't leave you incredibly sore. Because a lot, what I just showed you was body weight stuff. So that can be done on a rest day, but really like whenever you can fit it in. The only time I wouldn't do it is like immediately before. I wouldn't do that full battery of tests immediately before a speed workout. But otherwise, it's kind of just whenever you can fit it in, and it could be done on an easy day.
Yeah. Gwen asks, Hi, Kathleen. I have a hypervolt massage gun. I almost said machine gun. Kind of the same. Will that work in place of a foam roller?
Yes, yeah, that can replace the foam roller.
Yeah. Um, all good. Anybody else, either verbally or in chat, typed into the chat? Any other questions? I don't see any immediately. Anybody else? I will stay on and answer any questions that you have regarding the LA Roadrunners or whatever. Um, but if you have any further questions for Kathleen before we turn off the recording, please do so now.
I
Going
have a quick
once.
question.
Ah, there we
Hi, can you
go.
hear me?
Go
Hi.
ahead.
Yep.
Yeah, this is Felipe. I wanted to ask you about those compression boots or compression sleeves that you wear on your legs.
Yep.
Do you think that just um, laying with your legs elevated accomplishes the same thing, or is there something specific about those boots that you recommend?
Yeah, so the compression boots, there is like good evidence in support of them helping reduce post-exercise soreness. If you're in the boots for like 45 to 60 minutes. Um, I think that they are a nice to have, but not a must have. Um, you know, sitting with your legs up the wall, like it's a little bit different. There's not like the same. The science isn't exactly the same, but you're also focusing on fluid return just in a different way. The boots, like it's the method in which they like kind of compress and release and work their way from like ankle to up your leg. That's kind of supposed to help with flushing, like fluid and kind of all of the like cellular byproducts that build up in our tissues after a hard workout. So like flush that back up towards your heart. But like legs up the wall has been around for a really long time. So yeah, I think my stance on the recovery boots is like they're nice to have if you think you're gonna use them often and you're gonna sit in them at home for 45 to 60 minutes. Um, but I think like they're definitely not a cap, they're not a silver bullet. And to a certain extent, some of I think their benefit is like placebo as well. A nice to have, but like there's plenty of you can be a really successful marathoner without them.
Great. Joe wanted to know the name of the boots.
Oh,
Any
there's like a couple different brands. I think the two big names are Normatec and Therabody.
mm,
But there's Normatec's, I think, the most expensive. They're expensive. I have a couple patients that have like knockoff versions that they've gotten
mm.
that they seem to like. I don't know much about that. Uh, and I don't have names of those. I think I had a patient who bought a knockoff version at Costco like a couple years ago. But if you search like compression recovery boots, you should be able to kind of see Normatec and Therabody are the two big ones.
Good. I have nothing else right now. Anybody verbally or written? Any questions for Kathleen? Going once, going twice, going three times. Okay. Without
Great.
any other questions for Kathleen, I guess unless she wants to hang out and listen to questions about Ellie Roadrunners, which you're certainly welcome to do. I really want to thank having you on tonight. You're always a wealth of information. Like I said, or just a minute ago, I always learn something or remember something that I'd forgotten every time I listen to you. And I see a lot of thank yous coming in. Gwen said, thank you, Kathleen. And there are a couple, Neil and Vanessa and David, a lot of hand clapping. Mariano,
Thank
which you're
you.
probably seeing yourself, Alicia.
Yeah.
Yeah.
Yeah, I always enjoy this and I really love working with this group. If anyone has questions, we will be at the Big Dodgers Stadium meetup in December. But if anyone has questions, if an injury pops up, I did just drop my email in the chat. Feel free to email me. I work at our clinic in Hawthorne, but if that's not convenient for you, I can connect you with a PT that's closer to you. So yeah, I'm always here as a resource.
Great. With
And I'll
that,
be at Malibu Moves half on Sunday. So if you run Malibu Moves, come say hi to me.
oh, I'll see you there. We'll have our awning there. Our pace leaders
Great.
are in charge of pace leading that race officially.
Awesome.
So it's
That's three
exciting.
times in 1 week. What a treat.
Yeah, yeah. I will see you there.
Okay.
I will see you in Malibu.
Yes.
Yeah.
All right. Thank you guys so much.
Kathleen, thank you very much. I really appreciate it. I'm going to turn off the recording and I'll stay on. But for those watching the recording, thank you for watching. And Kathleen, thank you. Take care.
Bye.
Great. Bye.